Good day, Ma'am Kat Bonton. We are from the Group 3 of BSN 4B, and together with my group members, Buhawe Charibel, yours truly, Elpos Lorraine Grace, Espana Fatima Diana Nicole, Espiritu Crystal May, and Fagelan Maeve, we will be discussing about cerebrovascular accident and head and spinal injuries. So before we proceed with the topic, CVA, first let's have first a brief recall about the function of our brain. So we all know that our brain is the most important organ in our body because it is responsible in controlling of our emotions, reactions, as well as our memories and coordination. So our brain, yung two main arteries na nagsusupply ng um, blood sa ating blood supply sa ating brain are the carotid and vertebral arteries. And each area of our brain has a specific function. So when we say cerebrovascular accident or the medical term known as stroke, it occurs when the blood supply to part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. So our brain cells is very sensitive. So di nila kaya mabuhay ng sobrang ganun katagal kapag wala silang nakukuhang rich oxygenated blood. So within minutes, unti-unti silang namamatay. So when we say stroke, there's a loss of blood flow to part of the brain which damages brain tissues. So merong possible two causes. Pwedeng merong blood clots or broken blood vessels in the brain or pwedeng namang blockage or bleeding of blood vessels. So sabi sa incidence ng World Health Organization data published noong 2020, stroke deaths in Philippines reached 74,167 or around 11% of total deaths. So the age-adjusted death rate is 104.08 per 100,000 of population at pang number 66 ang Pilipinas sa may most number of stroke deaths noong 2020. However, sa ibang bansa, just like India, the stroke is one of the most leading cause of death and disability. And merong adjusted prevalence rate of stroke from 84 to 262 per 100,000 in rural and 334 to 424 over 100,000 in urban areas. And there is also a wide variation in cases, fatality rates with the highest being of 42% in Kolkata noong 2018. Ano ba yung mga risk factors ng stroke? Unang-una ay pagiging obese or overweight because yung kapag overweight ang isang tao, pwede siyang magkaroon ng complications such as hyperlipidemia, so merong high cholesterol, yung blood vessels is imbes na dugo yung dadaan, naka-block. So, nandun yung mga fatty material na nakabara sa artery wall. And then next is physical inactivity. Kapag wala tayong sapat na pag-exercise, hindi nakaka-circulate ng maigi yung ating blood sa all over our body. And use of illicit drugs such as merong mga stimulants such as cocaine, amphetamine, those stimulants has a direct effect on our cerebral circulations, including elevated blood pressure, vasculitis, and vasospasm. And then next is for medical risk factors, we have the hypertension or blood pressure readings higher than 120 over 80 millimeters of mercury. Hypertension, pag so much pressure, then elevated pressure sa loob ng blood vessels, na-narrow or nagra-rupture o pwede mag-leak yung blood, and it causes blood clots to form in arteries leading to brain blockage of blood flow. And then cigarette smoking or exposure to secondhand. So, cigarette smoking ay meron siyang toxic chemicals. So, this contributes to build up of plaque in the arteries and it deposited in the lungs or in the bloodstream. And just like what I mentioned earlier, high cholesterol or diabetes. So, nagkakaroon ng blockage sa blood vessels. And then next is obstructive sleep apnea. So those person na merong patigil-tigil na paghinga during a sleep. So when you say obstructive, merong decreased blood flow to brain, elevated blood pressure within the brain, and it harms the brain ability to modulate changes and prevent damage to itself. So most people na may sleep apnea are more likely to have or to suffer from stroke and they die in their sleep. And also cardiovascular diseases, including heart failure, heart defects, heart infection, or abnormal heart rhythm. Other factors such as the age, people aged 55 or older have a higher risk of stroke than do the younger one. Sa katulad ng mga senior citizens because as we grow older, hindi na ganun ka-resilient ang ating mga blood vessels as they used to be. So, nagnanarrow at hard, nagiging narrow and harder. So, nagkakaroon ng complications din, katulad ng mga kung meron tayong hypertension or diabetes mellitus, merong block sa ating artery wall ng mga fatty material. And then race. According to the research, mas mataas yung incidence ng cerebrovascular accidents sa mga African Americans because prone sila sa hypertension or meron silang uncontrolled high blood pressure. And then sex. Men have higher risk of stroke compared to women because again, during their younger age, pwedeng nag-abuse na sa alcohol or sa mga other drugs or sa mga cigarette smoking. So, naaabuso na yung katawan, nasira na rin yung ang mga blood vessels, kaya hindi na nagkaroon ng enough blood flow papunta sa brain. And we have three types of stroke. First is ischemic strokes that accounts for about 80 to 85%. And it happens when the arteries to the brain become narrowed or blocked, causing severely reduced blood flow or ischemia. Under ischemic stroke, we have three types: thrombotic, um, about 35% nangyayari siya habang tulog, and etiology because of perfusion failure distal to site of severe stenosis or occlusion of major vessels, and presentation slowly or gradually progressive deficit. And then embolic 30% occurs while awake, etiology due mainly to cardiac source, and presentation sudden immediate deficit or pwedeng magkaroon din ng seizure, and lacunar about 20%, etiology merong small lesion, and presentation abrupt or gradual. So as you can see naman dito sa picture, sa both embolic and thrombic, meron dun nakaharang sa loob ng artery wall kaya hindi makadaan ng maayos ang ating blood. And sa lacunar, merong lesion kaya naging narrow yung blood vessels, hindi rin makadaan ng maayos or walang maayos na blood flow papunta sa brain. So, ito din yung kanina as what I have discussed. Both of them, the area in our brain have deprived of blood and oxygen. So, the thrombotic and embolic stroke. Next is hemorrhagic stroke. When we say hemo, means it's blood. Hemorrhagic stroke, mayroong blood or bleeding. And it occurs when a blood vessel in your brain leaks or rupture. So, brain hemorrhages can result from many conditions that affect your blood vessels. Under hemorrhagic stroke, dalawang types, intracerebral hypertensive hemorrhage, about 10%, and in 90% of cases occurs when the patient is calm and unstressed. Prone yung mga black Americans or mga black people compared sa white ones. And etiology is elevated blood pressure, merong hypertension, and presentation gradual onset, pwedeng mag-last minuto lang over days. And sudden onset naman, pwedeng biglaan of local neurologic deficits. And next step is subarachnoid hemorrhage or mas tinatawag na ruptured aneurysm. About 5% ng mga tao ay nagsasuffer sa ruptured aneurysm. And it occurs during often strenuous activity, etiology from ruptured aneurysm and vascular malformations, and presentation is sudden onset. So, as you can see, both intracerebral and subarachnoid hemorrhage, meron siyang leak or pumutok yung ugat, kaya nag-leak yung ating mga at yung blood. So, hindi na siya nakakadaloy papunta sa ating brain. So, again, hemorrhagic stroke, merong break in blood vessel, and it leads to no blood to perfuse to brain cells and excessive swelling from the leakage of blood in the brain. And last type is the transient ischemic attack or the TIA, known as the mini stroke. So, temporary decrease in blood supply to part of the brain causes TIAs, which may last as little as 5 minutes. So, meron, as you can see sa picture, area of temporarily blocked blood flow. So, sa carotid, internal carotid artery pa lang, meron ng naka-blockage doon. And dito sa uh, close up na picture ng artery, merong blood clot in the middle of cerebral artery. So again, TIA known as a mini stroke. So yung signs and symptoms last for about minutes to hours. So kahit mini stroke lang siya, it's already considered as a warning sign kapag hindi natin nabago or na-modified yung mga bagay na pwede natin baguhin sa sarili natin, it will lead to pwedeng hemorrhagic or ischemic stroke.
Okay, so after malaman natin yung definition ng cerebrovascular accident or stroke and type, so proceed naman tayo sa signs and symptoms and preventions. So, yung signs and symptoms ng may cerebrovascular accident or stroke, so may acronym na tinatawag na BFAS. So, B stands for balance. So, makikita mo to sa isang tao na may loss of balance siya or nakaramdam siya ng headache or dizziness. And then E stands for eye, so may blurred vision. And then F stands for face. So yung one-sided ng face ni patient is drooping or asymmetric siya or hindi pantay, ganun. And then A stands for arm. So yung arm or leg ni patient is weakness or nangihina. And then yung S is stands for speech or speech difficulty. So yung may mga stroke na patient, so makikita nyo sa kanila na nahihirapan sila magkabuo ng sentence or word. And then T stands na po siya sa time or time to call for ambulance immediately. Then next slide. So, next slide naman po yung diagnostic evaluation. So, paano naman malalaman yung isang tao or na may cerebrovascular accident? So, dito, ginagawan or ginagamit yung physical examination and then ginagawa rin yung blood test and then CT scan, computerized tomography, and magnetic resonance imaging or MRI. And then meron din carotid ultrasound, ayan yung sa picture, and then yung cerebral angiogram, and then yung echocardiogram. So, yan yung iba't ibang ginagamit nila para ma-confirm yung isang tao na may cerebrovascular accident. Then, next slide naman po. So, next naman yung complication. So, once yung patient na-confirm na may stroke or cerebrovascular accident, so makikita yung complication na paralysis or loss of muscle movement, difficult talking or swallowing, memory loss or thinking difficulties, and then meron ding emotional problems, and changes in behavior and self-care ability. Then next po, so next naman is yung prevention. So kanina, nasabi doon sa risk factors na yung may mga taong na mataas yung blood pressure nila or may mga hypertension. So dito lang, ipe-prevent lang or maintain lang or control lang yung high blood pressure. And then lowering the amount of cholesterol and saturated fat in diet. So dito i-avoid lang yung mga maalat na pagkain. And then quitting tobacco use if yung patient natin is nag-smoke po siya. And then controlling diabetes, and eating a diet rich in fruits and vegetables, and exercising regularly, and drinking alcohol in moderation if at all. So, treating din yung obstructive sleep apnea and avoiding illegal drugs. So, kung ano lang yung nasa risk factor, so yun lang yung dapat need din na i-prevent. Then, when you say, next naman po is yung preventive medication. So, dito, um, pina-prescribe nila yung antiplatelet drugs, anticoagulant, and for medical management for the type of ischemic stroke, so emergency treatment with medication, so ang ginagamit nila yung therapy with blood-busting drug must start within 4.5 hours if they are given into the vein. So, intravenous injection of tissue plasminogen activator or TPA. For emergency endovascular procedure, so medication delivered directly to the brain, and then removing the clot with a stent retriever, so carotid endarterectomy and angioplasty and stent. So dito naman yung next naman po is yung sa hemorrhagic stroke. So, ano nga ba yung prevention nito? So, sabi kanina, yung hemorrhagic stroke is due to bleeding into the brain by the rupture of the blood vessels. So, ang ginagawa dito is surgical blood vessel repair. So, yan, makikita sa picture. So, maybe used to repair the blood vessels abnormalities associated with hemorrhagic stroke. And then, next naman po is yung surgical management naman. So, meron tinatawag tayong surgical clipping. So, yung surgical clipping po, yung mga neurosurgeon, nire-remove nila yung sections na fiscal na para ma-access yung aneurysm and malocate yung blood vessel na nagtitid dun sa aneurysm na yon. So, makikita dyan na iniipat yung um, aneurysm. So, yon nag-place sila ng tiny metal clip on the neck ng aneurysm para ma-stop yung blood flow into the brain. And then next naman po yung coiling na tinatawag or endovascular embolization. So dito naman yung procedure nito is involves yung inserting ng pin, tube, or cola catheter. So makikita dyan sa picture na may a catheter into a artery. So, yung catheter na yan, nagpa-pass through to the groin up to into the artery na nagko-contain ng aneurysm. Then, next naman po na surgical management is yung surgical AVM removal. So, yung AVM na tinatawag is a anteriovenous malformation. So, ito yung surgery closes in abnormal connection between the blood vessel that usually na nag-occur siya sa brain. So, dito, yung AVM na to is nagpe-prevent siya for normal delivery of oxygen to the vital brain tissue, which is nagre-result sa ng symptoms ng hemorrhage or bleeding and rupture. So, pag next naman po is yung tinatawag na stereotactic radiosurgery. So, ito yung technology na nag-use sila ng many small gamma rays. Yan na, makikita dyan yung liwanag na which is to deliver a precise dose of radiation to the target. So, it uses many precisely focuses, focus radiation beams to treat tumors, yun, and other problems in the brain. Then, next naman po is yung nursing diagnosis. So, ito yung mga nursing diagnosis na pwedeng gamitin sa cerebrovascular accident. So, una na yung pain related to increased intracranial pressure as evidenced by patient verbalations. And then, hyperthermia related to disease condition as evidenced by raised body temperature. And then, imbalanced nutrition less than body requirement related to less intake of food as evidenced by weight loss and disturbed sleep pattern related to his hospitalization as evidenced by patient verbalization. Then, next na po is yung other topic.
Okay. So this is the continuation of the cerebrovascular accident, which is the head and spinal cord injuries, and this will discussed by Miss Espana Fatima Diana Nicole M, Miss Espiritu Crestel May L, and Miss Vegalan Mayview. Next po. So first is the head injuries. Head injuries are one of the most common causes of disabilities and in death in adults. The injury can be as mild as a bump, bruise, or cut in the head, or can be moderate to severe in nature due to a concussion, deep cut or open wound, fractured skull bones, or from internal bleeding and damage to the brain. A head injury is a broad term that describes a vast array of injuries that occur to the skull, brain, and underlying tissue and blood vessels in the head. Head injuries are also commonly referred to as brain injury or traumatic brain injury (TBI), depending on the extent of the head trauma. Next po. So, traumatic brain injury or TBI. Traumatic brain injury usually results from a violent blow or jolt to the head or body. An object that goes through brain tissue, such as a bullet or shattered piece of skull, also can be cause traumatic brain injury. Mild traumatic brain injury may affect your brain cells temporarily. More serious traumatic brain injury can result in bruising, torn tissues, bleeding, and other physical damage to the brain. These injuries can result in long-term complications or death. Next po. So the most common causes of head injury is vehicle collisions and falls. Other causes of head injury is firearms, assaults, sports-related trauma, recreational injuries, and war-related injuries. And for the incidents, males are twice as likely to sustain a TBI as females. Men are more likely to expose to injuries than women because they are more likely to engage in an injury prone work or in a dangerous behavior. Next po. So these are the types of head injuries. First is the concussion. This is the most common type of head injury. A concussion is a type of traumatic brain injury or TBI that happens when the brain is jarred or shaken hard enough to bounce against the skull. It can range from mild to severe. You don't have to be hit in the head to get a concussion. An impact elsewhere on the body can create enough force to jar the brain. The concussion is a mild form of traumatic brain injury. Cause siya by yung bump, blow, or jolt dun sa head ng mga tao. And concussions can also occur from a fall or a blow to the body that causes the head to move rapidly back and forth. And next is the contusion. A bruise on the actual brain itself is called a contusion. It can cause bleeding and swelling. Swelling inside the body around the area where the head was struck. A contusion may occur with skull fractures or other blood clots such as subdural or epidural hematoma. Next is the intracranial hematoma (ICH). This is bleeding under the skull in the brain that forms a clot. Brain hematomas range from mild to severe and are grouped according to where they form. Next po. Next is the skull fracture. Sometimes a broken skull can affect the brain. The broken pieces of bone can cut in the brain and cause bleeding and other types of injury. The type of severity of a skull fracture depend on the velocity, momentum, direction, and shape, blunt or sharp, or the injuring agent and site of impact. A skull fracture is a break in the bone of the skull. For most skull fractures, treatment consists a close observation in the hospital and medication to relieve pain during the healing process. However, some skull fracture requires surgery. And next po. So these are the types of skull fracture: linear, depressed, simple, comminuted, and compound. First is the linear. A description of linear skull fracture is break in continuity of bone without alteration of relationship of parts. This is the most common type of skull fracture. wherein there is a break in the bone but the bone does not move. And yung cause niya is yung mga low velocity injuries. And next is the depressed skull fracture. Description is inward indentation of skull. This type of fracture may be seen with or without a cut in the skull. In this fracture, part of the skull is sunken from the trauma and may require surgical intervention depending on the severity to help correct the depression. And yung cause niya is yung mga powerful blow dun sa head ng pasyente or tao. And next is the simple skull fracture. Simple skull fracture is a break in the bone without damage to the skin. Yung ano niya dito, description, linear or depressed skull fracture with the fragmentation or communicating laceration. And yung cause niya is too low to moderate impact. Next is the comminuted description, multiple linear fracture with fragmentation of bone into many pieces. Yung ito naman, these are those in which bone is shattered into many pieces. Can result in a bits of bone being driven into the brain and lacerating it. Yung mga cause niya is yung mga direct and high momentum impact. And last is the compound skull fracture. Description is this depressed skull fracture and scalp laceration with communicating pathway to intracranial cavity, and yung cause niya is severe head injury. Next po. So for the manifestation of skull fractures, yung location is frontal fracture. Kapag nagkaroon ng fracture dun sa frontal, yung mga manifestation niya is exposure of brain to contaminants through frontal air, possible association with air in forehead, tissue, such as yung phrenoria or pneumocranium, air between the cranium and the dura mater. And next is the orbital fracture, perioorbital ed- Edeomosis, raccoon eyes, optic nerve injury, temporal fracture, yung manifestation niya is boogie, temporal muscle because of extravasation of blood, oral shaped bruise behind ear in mastoid region, or battle sign, yung ating CS photoria, middle meningeal artery disruption, epidural hematoma. Uh, Next is yung parietal fracture, deafness, for brain otorrhea, bulging of tympanic membrane caused by blood or facial paralysis, loss of taste, and battle signs. Next is the posterior fossa fracture, occipital bruising resulting in cortical blindness, visual field defects, rare appearance of ataxia or other cerebellar signs. And last is the basilar skull fracture for brain otorrhea, bulging of tympanic membrane caused by blood or battle signs, tinnitus or hearing difficulty, rhinorrhea, facial paralysis, and conjugate deviation of gaze and vertigo. Next po.
So, before we start our discussion about spinal cord injury, let's begin by discussing the anatomy and physiology of spinal cord. So, the spinal cord is a long tube-like band of tissue. Kinokonek ng spinal cord ang brain natin to our lower back. Our spinal cord is a delicate structure and it contains nerve bundles and cells. And itong mga nerve bundles na to, it carries nerve signals from our brain to our body or vice versa. So, these nerve signals help us feel sensations and move our body, and that's the reason why any damage to our spinal cord can affect our movements and functions. So the spinal nerves arise along the spinal cord, and these are categorized by the region of the vertebral column from which they emerge. We have the cervical, the thoracic, the lumbar, sacral, coccygeal, The spinal nerves are also numbered starting superiorly according to their order within that region. So the 31 pairs of spinal nerves are therefore C1 to C8, T1 through T12, L1 through L5, and S1 through S5, and COX6. So another thing is that knowing which of these spinal nerves innervates will help us better understand which regions of the body are impacted by spinal cord injuries. So for the cervical spine, the C1, it innervates our head, the brain, inner and middle ears. C2, it innervates the auditory nerves, sinuses, eyes, tongue. C3 innervates the tooth, cheeks, outer ears. C4 innervates the nose, mouth, lips, eustachian tubes. C5 innervates the pharynx, vocal cords. C6 innervates shoulders, neck, tonsils. C7 innervates thyroids, elbows. For thoracic spine, T1, it innervates the trachea, esophagus, lower arms, fingers. T2, innervates the heart. T3, innervates the lungs, chest, breast. T4, innervates the gallbladder. T5, innervates the liver, blood circulation, solar plexus. T6, innervates the stomach. T7, innervates the pancreas, duodenum. T8, innervates the spleen. T9, innervates the adrenal glands. T10, innervates our kidneys. T11 are ureters, T12 small intestine and lymph circulation. For the lumbar spine, L1 it innervates our large intestines, inguinal region. L2 our abdomen, appendix, upper legs. L3 bladder, sex organs, knees. L4 sciatic nerves, prostate gland. L5 lower legs, feet. S1 sacrum, our hip bones and buttocks, and the coccyx innervates our rectum and anus. So next. So spinal cord injury is a major health disorder, and most spinal cord injuries come from a sudden traumatic blow to the vertebra. And yung fractured or broken bones na yun damage the spinal cord and its nerves. So in rare cases, an injury can completely severe or split the spinal cord na pwedeng mag-result in either a temporary or permanent alteration in the function of our spinal cord. Sabi sa data, 12,000 Americans suffer spinal cord injuries each year. So about 260,000 daw in the United States are living with spinal cord injury. With improved treatment strategies, kahit na yung mga pinakabatang patient with uh, spinal cord injury, pwede silang mabuhay ng matagal. So young adult men between ages 16 and 30 years old have the greatest risk for spinal cord injury. Sabi, 81% of people with spinal cord injury are male daw. Why? Because men are most likely to have spinal cord injury because they are prone to violence, motorcycle usage, participation in sports, dangerous driving, and reckless decisions. So kahit na many people with spinal cord injury can care for themselves independently, those na may pinakamataas na level of injury may require round-the-clock care at home or in a long-term care facility. And almost the mga patient with spinal cord injury are discharged from the hospital to home or another non-institutional residence. And yung remaining percent naman are discharged to nursing homes or other chronic care facilities. So next. So most common causes are from motor vehicle collisions. Approximately 42% are caused by this. So another one is from falls, and this accounts for 27%, 15% from violence, sport injuries, 7%, and other miscellaneous causes accounts for 8% of the spinal cord injury. Next. Types of injury. So the extent of the neurologic damage caused by spinal cord injury results from primary injury and secondary injury. So primary injury, ito yung resulta ng initial insult or trauma sa spinal cord. So spinal cord injury it can be due to cord compression by bone displacement, interruption of blood supply to the cord, or traction resulting from pulling on the cord, penetrating trauma such as gunshot and stab wounds can result in tearing engine section or nagdivide. Secondary injury, this refers to the ongoing progressive damage that occurs after the primary injury. So, several theories exist on what causes this ongoing damage, and this includes yung free radical formation, uncontrolled calcium influx because ang nangyari to because after a spinal cord injury there will be immobilization. So yung osteoclast natin will cause bone resorption. And yung calcium na nilabas from bone resorption will be excreted in the kidneys. And kapag nag-exceed na yung calcium sa capacity ng urinary excretion, hypercalcemia results. And ischemia or blood flow is ischemia or yung kapag yung blood flow is restricted or reduced in part of the body, and lipid peroxidation process siya in which free radicals steal electrons from the lipids in cell membranes, resulting in cell damage. And apoptosis or cell death, and this occurs and sometimes may continue for weeks or months after the initial injury. And pinapaniwalaan ng mga experts that secondary injury is the principal cause of spinal cord degeneration at the level of injury, and reversible siya during the first 4 to 6 hours after injury. So that's the reason why napaka-important for us to get early treatment to prevent partial damage from becoming total and permanent. Next. So we have three classification. We have three classification of spinal cord injury. We have the mechanism of injury, level of injury, and degree of injury. Next. Cervical spine injuries are best classified according to several mechanisms of injury. So this include the flexion injury. As you can see in the picture, this happened when there is a rupture in the posterior ligaments, and this can also occur in the lumbar spine following a fall in the bent position or an object ay nalaglag sa likod natin. Next. Next. Next is the hyperextension injury, and this is the opposite of the flexion injury. And this happened when there is a rupture in the anterior ligaments. So most common na nangyayari siya in the cervical region, and common cause niya is from lower cervical neck injuries. Next. 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 Next po. Next, ayan. Okay, so compression fractures, it crush the vertebra and force bony fragments. And this occur kapag yung bony or vertebral body in the spine collapses. Next. Flexion rotation injury of the cervical spine often results in tearing of ligamentous structures that normally stabilize the spine. And this occurs due to the destructive forces. So you can see in the picture that there is a disruption of the posterior and middle spinal columns. And this injury is most often implicated in severe neurologic deficits. Next po. Level of injury, skeletal level of injury is the vertebral level where there is the most damage to vertebral bones and ligaments. Neurologic level is the lowest segment of the spinal cord with normal sensory and motor function on both sides of the body. So the level of injury may be cervical, thoracic, lumbar, or sacral. Kapag yung cervical and lumbar ang naapektuhan, these injuries are most common because these levels are associated with the greatest flexibility and movement. So if the cervical cord is involved, paralysis of all four extremities occurs, resulting in tetraplegia or formerly termed as quadriplegia. However, when the damage naman is low in the cervical cord, the arms are rarely completely paralyzed. So if the thoracic, lumbar, or sacral spinal cord naman is damaged, the result is paraplegia or paralysis and loss of sensation in the legs. Next. So, degree of injury. A complete injury from the word itself, complete, so it causes total paralysis, loss of function below the level of injury, and it affects both sides of the body. So, best example nito is when it causes paralysis of all four limbs or the quadriplegia, or the lower half of the body or the paraplegia. In an incomplete injury, there may be loss of sensation and motor activity, but some function remains on one or both sides of the body. Some are still intact, unlike sa complete injury, like our body. Dito sa incomplete injury, our body and brain can still communicate along certain pathways. Next. And lastly, this image shows the level of injury and degree of paralysis. So for us to remember it well, let's take this in our mind. The more na mataas ang level of injury, the more na severe ang degree of paralysis.
Okay, for the continuation, we have the six syndromes in the spinal cord injury. That is incomplete injuries, which are the central cord syndrome, anterior cord syndrome, brown sequard syndrome, posterior cord syndrome, quadricina syndrome, and conus medullary syndrome. Okay, so next slide. So here are the common types of incomplete spinal cord injuries. So ayan na yung mga binanggit ko kanina. Sa brown sequard syndrome, affected yan either left or right. Depende po kung anong part yung affected. And then for the anterior cord syndrome, we have the back of the spinal cord. And then the next is the posterior, yung front. And then for the central cord syndrome, so sa center yan. Sa next slide po, sa first, we have the central cord syndrome. So this is the most common form of an incomplete spinal cord injury that is characterized by an impairment in the arms and hands, and to the lesser extent in the legs. So this is the brain's inability to send and receive signals to and from parts of the body below the site of injury that is reduced but not entirely blocked. So hindi naman siya block lahat. There are parts of the body that is affected lang kasi hindi makapag-send ng signal yung brain. So here are the manifestations. We have the motor weakness and sensory loss that are present in both upper and lower extremities. And also there are upper extremities that are affected more than the lower ones kasi failure ng brain na mag-send sa spinal cord into the other parts of the body ng signal, meaning it has loss of coordination and function. Okay, next slide. For the anterior cord syndrome, we have the incomplete uh, or predominantly affects the anterior two-thirds of the spinal cord, resulting in the motor paralysis below the level of the lesion, as well as the loss of pain and temperature at and below the level of the lesion. So, na-mention nga dyan na there is a loss of pain already and also the temperature, hindi na sila makasense. And also, yung two-third part na po ng ating thoracic, yung sinabi ni Miss Fatima kanina, yung T1 to T12, that is the most affected part dyan sa anterior cord syndrome because it connects the ribs, yung rib natin to protect the heart. And also the manifestation of this, we have the motor paralysis and loss of pain and temperature na already mentioned na kanina, temperature sensation below the level of injury, and of course the posterior cord tracts that are not injured, sensation of touch, position, vibration, and motion remain intact. So yung affected part dyan, if you, from the view ng posterior, uh, ano siya, hanggang chest level na yung damage. Next slide po. For the Brown Sequard syndrome, this is a rare neurological condition that is characterized by a lesion in the spinal cord which result in weakness of paralysis or yung hemiparaplegia on one side of the body and a loss of sensation on the opposite side. So ang nangyayari dito, either the right or left of your legs, yung isa kung hindi siya paralyzed is loss of sensation. Here is the manifestation of this. We have the ipsilateral, same side as the injury, loss of motor function and position and vibratory sense, or vasomotor paralysis, and also the contralateral opposite side of the injury, loss of pain and temperature sensation below the level of injury. Next is the posterior cord syndrome. So, sa posterior cord syndrome, this is a rare type of incomplete spinal cord injury that affects the dorsal columns of the spinal cord, which is found in the posterior or backside region of the spinal cord, and is responsible for the perception of the fine touch, vibration, sense of self movement, and body positioning. The manifestations are generally the dorsal columns are damaged, resulting in loss of proprioception or yung body positioning, also the pain, temperature, sensation, and motor function below the level of injury remain intact. Next slide po yung conus medullaris syndrome and quada equina syndrome. This is a result from damage to conus or the lowest portion of the spinal cord, and yung quada equina, yung lumbar and sacral nerve roots na yan. So ito yung manifestations niya are the flaccid paralysis of the lower limbs and are flexic, flaccid bladder and bowel. So, additional lang pala sa conus medullary syndrome, this is a type of incomplete spinal cord injury that causes paralysis than any other types of spinal cord injuries. Hindi man siya um, nakaka-experience ng paralysis, but most commonly there is severe back pain, strange or jarring sensations in the back such as buzzing, tingling, or numbness. Okay, here is the impairment scale, which is the Asia or American Spinal Injury Association impairment scale. So ito yung scale on how you will grade the spinal injury from A to E. Okay, next po. Continuation po, there are complications of spinal cord injuries again. Okay, next slide po. This is a complication from the spinal cord to the other parts of the body. First, from the respiratory system. So, the cervical injuries above the level of C4 is present. So, for example, this is characterized by the low lung volumes and a weak cough secondary to the respiratory muscle weakness. Kasi uh, this has the autonomic dysfunction and early onset sleep disordered breathing compound that is respiratory compromised. And also, this is the most common complications, like for example, the atelectasis, the pneumonia, and the respiratory failure. And also, we have the cardiovascular system. This is just above the level of T6, which is greatly decreases the effect of the sympathetic nervous system. Why? Kasi meron tayong circulatory problems dito. For example, we have the orthostatic hypotension like pagkabangon mo or biglang tayo mo, biglang bababa or your BP or blood pressure will lower. And then also kasama na rin dito yung swelling of the extremities. So the circulation changes and also increase your risk for developing blood clots such as deep vein thrombosis or pulmonary embolus. And also it is connected to heart because sabi ko nga kanina, this is connected to the rib cage that protects our heart and lungs. So kapag meron siyang problem, so maapektuhan talaga yung cardiovascular system. And then for the urinary system, so urinary retention is the common development in acute SCI and spinal shock. Kasi there is that injury that cause nerve compression or damage. Ito yung neurogenic bladder disorder, also termed as bladder dysfunction. So this means that the patient has problems with urination. So magkaka-problem na siya sa urinary incontinence, renal impairment, urinary tract infection, stones, and such poor quality of yun, condition ng urinary system niya. For the gastrointestinal system, now if the SCI has occurred above the level of T5, the primary GI problems are related to hypomotility. Why? Kasi, wait, Kasi the spinal cord is responsible for sending nerve signals throughout the body, including the digestive system. So therefore, any issues that impacts the function ng spinal cord natin and the proper communication between the nerves, so it can potentially cause digestive problems. So mostly nandiyan yung commonly nandiyan yung constipation, distension, abdominal pain, rectal bleeding, also the hemorrhoids kasama siya, the bowel accidents and autonomic hyperflexia. And for the integumentary system, this is a major consequence of lack of movement and is the potential for skin breakdown over bony prominences. So, ayun, so from the inside kasi yung spinal cord natin. So, kapag nag-book yan, like sobrang compromise talaga nung spinal cord natin. So, madadamage din. May possibility na madamage din yung outer part like yung integumentary system natin. Kasi pwede siyang lumabas sa balat. So, yung integrity po ng ating skin, so madadamage siya. And is also can result to pressure ulcers and can occur quickly and can lead to major infection and sepsis. Okay, next po. For here are the non-operative treatments. So we have the stabilization of the injured spinal segment and decompression, also either through traction or realignment. So may realignment yan. And the stabilization methods that eliminates damaging motion at the injury site, because these methods are intended to prevent secondary spinal cord damage that is caused by repeated contusion or compression. Next slide for last slide, the surgical therapy. Okay, we have the surgical therapy, but it is also depends on the physician's preference. Depende po sa level ah, kung talagang kailangan na ng surgical therapy, and also the decompression and stabilization of the spinal column. So the criteria that is used in the decision for the early surgery, this is to assess the patient if ano na talaga siya, kailangan na siyang i-surgery. There is evidence of cord compression, also the progressive neurologic deficit, also the compound fraction of the vertebrae, the bony fractures that may dislodge and penetrate the cord. As I said kanina, lumalabas na rin sa balat, and also the penetrating ones of the spinal cord or surrounding structures.